clearing off the bench because we have had a lot of rain here in Melbourne, but that's okay. We can handle things.
That's right.
It's going to be a little bit wet.
That's right.
So we are out here on the bench, downtown Melbourne, talking about homelessness, having the hard conversations, and looking for solutions. So we've got the Space Coast Health Foundation. Lisa has joined us, and we're going to talk about all the things. We're going to talk about whatever comes up. First, can you tell us a little bit about you and Space Coast Health Foundation?
Of course. So, firstly, I'd like to say I'm a night owl, so I've been watching you all night.
Aw, that's wonderful.
And so I brought you some sunshine because I know it's been raining,
Thank
cats
you.
and dogs. You're very welcome.
Nobody else brought me flowers. No, this is fantastic. I'm going to put them right here.
You're welcome. Yes, because
thank you.
Thank you to everyone that's been out here in the rain, putting up the tents in the soaking rain, and bringing awareness to this. So thank you. So I am Lisa Hickman. I am the executive assistant to Johnette Gindling, who is the president, CEO of the Space Coast Health Foundation.
Yeah.
So the Space Coast Health Foundation is located in Rockledge. We operate 3 programs. Probably the one that you're most familiar with is the Center for Collaboration, which is there on US 1 by Space Coast Credit Union and Arby's there. A lot of people know it because they've been there for meetings. We also operate the Children's Advocacy Center of Brevard and Lifetime Counseling Center.
Okay.
So those are our big programs.
Okay. And how long has the Space Coast Health Foundation been around?
I'm so glad you asked that.
Yes.
October 1st was our 15th year anniversary.
Okay. So you're about the same age as us. We're teenagers. In the community.
Yes.
We've been around 16 years.
Wonderful.
So, oh my gosh, so many
So we're
questions.
just getting beginning, right? We're just
getting started. And you're well known in the community. So how do you feel like the Space Coast Health Foundation wraps around the issue of homelessness? What role do you see yourself playing in a solution?
Well, a little background. The Lord gives us talents, right? And it's our job to utilize those talents for good. So I've been very fortunate, and I found this position at the Space Coast Health Foundation. I'm able to utilize my talents, which is supporting people. So that's my job. I support all the leaders and anybody that's out in events or anything that they're doing. And when I first started, I found out all the amazing things that the Space Coast Health Foundation was doing. And I said to our COO, Donna Bishop, I said, why aren't we promoting this? Why aren't we pushing this out even more and more, sharing all the good that we're doing? And she said, well, because that's not who we are. We're here to support all of the people that are the boots on the ground, the heavy lifters. So we're here to help them. So that's what everyone in our organization does. We utilize our talents to help everybody that has talents that are out in the community.
So how do you think you help?
So one of the things that we do, every 3 years, we put out a community health needs assessment.
Yes.
And so that is something that we don't collect the data. We have PRC who goes out and collects the data for us. So they collect data throughout the Brevard County, and they very scientifically figure out North, Central, and South Brevard and get the same amount of people to answer these survey questions. And then we collect all that data, and then they put it into all these charts and things like that, and then we share that out to the community.
And what kind of data are they collecting?
So that data collects all kinds of health, and actually, I brought my papers. I've been protecting them because I didn't want them to get wet, because then I wouldn't have my numbers.
So it's a community needs health assessment.
Right, community health needs assessment.
Okay.
And it collects all kinds of data. And the one paper I didn't
for the 2022 one, I read all. How many pages?
Yes, there's
a lot of pages.
Lot. So there's a lot for everybody, and it's funny because I'll talk to people and they're like, "Oh my gosh, we look at your community health needs assessment all the time for data." But one of the things that we do have in here is called housing, and so when they surveyed people, our Brevardians, Let's
Let
see.
me hold this
Oh,
so that
thank
you
you.
can,
I appreciate that.
yeah.
Okay, so the frequency of worrying or stress over paying rent. So when they surveyed Brevard, 40% of people have the stress of paying their rent or mortgage. 40%. And then in the United States, it's 45. So you can kind of see where
Okay.
Brevard County's at, right?
Yep.
And that's kind of scary. So that kind of plays into the homelessness, right? Because once you're stressed about that, because
So
you think
you're likely living paycheck to paycheck.
exactly, which brings me to another another question that we ask is, um, if you would have an emergency and you would have to pay $400, would you be able to do it in cash? And Brevard County said 29.6% would not be able to pay. And then versus the US is 34%.
Okay.
So Brevard County numbers are high.
Yeah, they
So we've got
absolutely
some
are.
stressed out people that, they're struggling financially and worried about their mortgage and rent. And then we also asked about unsafe housing conditions. 18.3% of Brevard Countyans say that they are, and compared to a 16% in Florida.
Okay. So when you get this information, when you get this data, how are you putting it out there, and then how are you using it?
So it is out on our website for anyone to view. You just go to spacecoasthealthfoundation.org, and you'll see a tab there, and you can click it to get the most recent data. And there's a lot of data, I
Yeah.
will tell you, very useful. And then what we do is we use it when we get the data, before we publicize it, we share it to our board of directors. And our board of directors gets a chance to look at it in a presentation. And then they get to rank the things that are brought up in this survey. And so they're ranking projects almost. And of course, the homelessness is the first one that came up.
Okay.
Mental health was the third or second or third, I believe. And then we bring it to our Foundation Advisory Council, who is a healthcare people that are in healthcare. They
Sure.
come to a meeting at our facility once a quarter, and we get together and discuss these things. And they also looked at it and ranked their priorities as far as what they feel is Brevard County needs.
Yeah.
And homelessness again came up together.
And there's the things underlying that lead to homelessness.
That's correct.
Right. And so what we've seen is just the mental health crisis.
That is correct.
Um,
And so that's another thing that we track on this healthcare, the community healthcare needs assessment.
this is why I read the whole thing, because it is really fascinating.
Yeah, it really is. So one of the things that I thought was interesting is that the percentage of people that have been diagnosed with just depression, depression, for Brevard County was 30%.
Yeah.
Compared to the U.S. is 30.8.
Right.
Wow.
So it's pretty.
So our community's hurting. And then we have the people that are experiencing symptoms of chronic depression is 44%.
44.
44%.
44%. And these are people that are self-aware
Right.
of
That's correct.
what they're feeling. Some people might not even fully understand what
Right.
they're experiencing.
So this is symptoms of chronic depression is 44%, which is self-awareness,
Yeah.
right? This isn't diagnosed, but we do have the number of diagnosed anxiety disorder. This is diagnosed.
Yeah.
33%.
Mm-hmm.
So where does that 11% that's in between there, what happens to them?
Right.
If they haven't been diagnosed, but they know they have depression.
Yeah.
So another number we have is receiving mental health treatment. Only 24% are receiving it.
And what we're hearing is there's just not enough providers out there,
That's
which
correct.
is part of the reason that we have just started pouring a lot of money into mental health. And all of the women and children in our program get free services. We evaluate everyone.
That's amazing.
And my statistic is 100% of the women who come into our program either experience depression or anxiety. And even the experience of being homeless, there's anxiety in that, and they're in survival mode.
Yeah.
And so to help them take a breath and take a beat.
That's amazing.
Yeah.
That is amazing. And one of the other numbers that we have here is too is unable to get mental health is 15% in Brevard County.
And do you think it's health insurance? Do you think it's finding
Correct.
availability?
Availability, unable to get there. So
Transportation.
even simple as transportation, they can't get there. And financial. And I know that Lifetime Counseling Center during COVID had a waiting list that was very, very long, and even after COVID. So I know that there was a lot of people out there that needed help, right? Or need somebody to talk to. And I knew another thing that a lot of the mental health professions they struggle with is the reimbursement rate for Medicare. I don't know the numbers, but let's just say if your visit's $100, well, you're only going to get reimbursed $80. So
Yeah. There's some out-of-pocket expense, and if you're living day to day, if you're just surviving, that might be.
well, that extra $20 though gets passed on to the Lifetime Counseling Center. So
Okay.
we would cover that because it's a Medicaid or
Gotcha.
Medicare.
Okay.
Right.
Okay.
So and that hurts a little bit, right?
Right.
So the bottom line, anyway. And of course, we're always happy to help people, and that's what we're here for. And the Space Coast Health Foundation, that was one of the reasons why they brought Lifetime Counseling Center onto their programs, because they wanted to keep this program going because they knew out of all the numbers of the community health needs assessment that something that we needed.
Right. And what is their capacity for serving? How many people are part of Lifetime Counseling? I just put you on the spot with that question.
You did, and we just recently did a video for our 15-year anniversary, and I'm trying to remember the number because Lori talked about it. Was it 15,000 people? Oh, Wayne is here. Wayne Price. He's out there trying to give me messages.
Yeah.
I think it was about, I believe, 15,000 people they've served since they've been with the foundation.
Okay.
So, and I think that was, they've only been with us maybe 10 years.
10 years. Yeah. And
So
there's
they've
so
done a lot
much
of good.
need
Right.
out there. So how do you see the Space Coast Health Foundation coming alongside nonprofits?
So we are the Space Coast Health Foundation. That is one of our main things. We believe in helping the nonprofits, and one of the ways that we do that is the Center for Collaboration. We have community rooms there, and we do offer that space to our nonprofits at a discounted rate, so that they can get together and collaborate.
Right.
Hence the name Centers for Collaboration.
Yeah.
And then Janet Gindling, our president, CEO, she is on a lot of the different boards and is always there to lend a hand. And we also do offer grants for the betterment of Brevard, for the health of Brevard, to
Right.
make Brevard a healthier place.
Yes, absolutely. And we need that. And the theme has been better together.
Better together. Isn't that amazing? That's great.
Yeah.
I love it.
Anything else you want to share about the Space Coast Health Foundation?
I really don't, because once again, we are there to help and support everybody in Brevard County, and I've been watching all night, like I said, and so many great people that you've had on and all the great things that they're doing. It's just amazing. So
Yeah.
we're happy to be a part of it and there to lend a hand. And once again, if you wanted to get any of the numbers, you can get it off our website. If there's anything that I spoke about and you need clarification, please feel free to reach out to us. Once again, I'm not the normal person that would come out and talk, so but I'm very happy to be here.
Yeah. Well, we appreciate you being here. And education is a huge piece.
It is.
People educating themselves about what the community needs. Education is power.
That's right.
So,
And one of the other things I think we recently, with the Rockbridge Hospital closing,
Yes.
that has hurt the community. Even with the numbers in the community health needs assessment, people that go to the ER. I was looking at it this morning. It was 13% just in the north and central. 13% of the people had visited the ER twice in 1 year.
wow.
So now we're down a hospital that had 298 beds.
Mhm.
So that's another thing that the Space Coast Health Foundation, we are very passionate about and trying to help find access to health care for our Bermudians.
Well, that's great. All right. Well, thank you so much. I appreciate you
welcome.
being out here in the rain and
That's right.
taking time with us.
Thank you very much.
All right. Off we go, John.